Should diabetic people drink turmeric and honey? This seems like a simple question, but behind it lies a series of medical facts that not everyone knows. If you or a loved one is living with diabetes, this video can help you avoid dangerous mistakes and find out how to use it correctly to protect your long-term health. Watch until the end of the video, because at the end I will share recommendations from a nutritionist, which can help you control your blood sugar more safely. According to a study by Harvard Medical School published in the Journal of Clinical Nutrition, the active ingredient curcumin in turmeric can help reduce chronic inflammation, a root cause of insulin resistance. Meanwhile, honey, although still sugar, has a lower glycemic index than refined sugar, but if used incorrectly, it can still push blood sugar to dangerous levels. Important question. Can diabetes people combine turmeric and honey, or is this just a trap from folk experience? Part 1. Turmeric and curcumin. Miracle medicine or double-edged sword? 1. Why is turmeric famous among the people? Since ancient times in traditional medicine, turmeric has been considered a miracle drug. Vietnamese people often use crushed fresh turmeric mixed with honey to treat stomach pain. Indians use turmeric in curry to reduce inflammation and enhance flavor. Japanese people add curcumin from turmeric to many functional foods. But is the miracle drug really safe for type 2 diabetes patients? 2. Curcumin. The main active ingredient in turmeric curcumin is the substance that gives turmeric its golden yellow color. Modern studies have shown powerful anti-inflammatory, inhibits NF-κB, an inflammatory protein, antioxidant, protects pancreatic beta cells from damage, improves insulin sensitivity, helps glucose enter cells more easily. Scientific evidence. A study of 240 pre-diabetic patients. PubMed, 2012. After 9 months of taking curcumin, 16% of participants avoided the risk of developing type 2 diabetes. A synthesis of data from the Mayo Clinic, 2020, also confirmed curcumin has the potential to support HbA1c control, but requires a standardized dose, not from eating raw turmeric. 3. Potential benefits of turmeric for diabetics. Reduces chronic inflammation, reduces the risk of insulin resistance. Stabilize blood sugar, helps the pancreas work more effectively. Protect the heart. Diabetes is often accompanied by lipid disorders. Curcumin helps reduce bad cholesterol, LDL. Prevent complications. Thanks to its antioxidant properties, turmeric helps protect the nerves and retina. If you find turmeric is truly a superfood, please click like so more people know about this information. 4. But what are the potential risks? Not everything that is good for health is absolutely safe. For diabetic patients, turmeric has the following risks. Causes stomach ulcers if used in high doses. Curcumin increases bile secretion. Affects blood clotting. If the patient is taking anticoagulants, warfarin, turmeric can increase the risk of bleeding. Drug interactions can change the effectiveness of hypoglycemic drugs. Metformin, insulin. Incorrect dosage. Eating fresh turmeric or traditional turmeric powder often makes it difficult to control the curcumin content. A report in the Journal of Clinical Pharmacology, 2018, noted, patients using more than 8 g of curcumin day for 2 months had symptoms of nausea, abdominal pain, and diarrhea. 5. Fresh turmeric, turmeric powder, or supplements. Fresh turmeric contains many impurities, difficult to absorb. Folk turmeric powder, risk of mixing, impurities, unstable dosage. Standardized curcumin tablets, better absorbed, supported by clinical research. Doctors often advise, if diabetic patients want to use curcumin in 500 mg day tablets instead of eating turmeric powder mixed with honey. 6. Real story. I once read a report about a 56-year-old female patient with type 2 diabetes in Ho Chi Minh City. An acquaintance told her to use turmeric and honey every morning. After 2 months, her fasting blood sugar increased from 7.2 mmol/L to 8.9 mmol/L. and her HbA1c increased from 6.8% to 7.6%. When she went to the hospital for a checkup, the doctor concluded that the main cause was honey, not turmeric. However, because she used unrefined fresh turmeric, she also had a stomach ache. After switching to 500 mg day curcumin tablets, combined with a healthy diet, her HbA1c, after 3 months, decreased to 6.5%. Do you know anyone who has used turmeric and honey to treat an illness? Please share that story in the comments section for everyone to refer to. 7. Summary of turmeric and curcumin benefits. Reduces inflammation, stabilizes blood sugar, protects the cardiovascular system. Harmful, causes stomach ulcers, drug interactions, difficult to control dosage. Recommendation: if diabetic patients want to use, choose standardized curcumin tablets, consult a doctor. We have just analyzed turmeric and curcumin. Is it really a miracle drug for diabetic patients? But what about honey? Many people think that honey is natural sugar, so it is safe. Is that true or not? In part 2, I will analyze the truth behind honey, a sweet but risky food for diabetic patients. Part 2. Honey. Sweet or a trap for diabetes? 1. Honey in folklore and science. For thousands of years, our grandparents have used honey as a natural panacea. Mix honey with lemon to treat coughs. Honey combined with turmeric to treat stomach pain. Drink honey in the morning to increase energy. And many people believe honey is a natural sugar, so it is better than granulated sugar. But for diabetes patients, is the truth that simple? According to the American Diabetes Association, ADA 2022, honey is still a form of simple sugar, glucose plus fructose. When entering the body, it will increase blood sugar, almost similar to white sugar. 2. Glycemic index, GI, and glycemic load, GL. The GI of honey ranges from 45 to 64, depending on the type, while white sugar, sucrose, is 65. That means honey has a slightly lower GI, increases blood sugar more slowly than white sugar. However, the glycemic load, GL, is important. A spoonful of honey, Y21G, provides up to 17 grams of sugar, can still cause blood sugar to rise rapidly if used regularly. A study in the Journal of Medicinal Food, 2018, type 2 diabetics ate 1 spoonful of honey/day for 8 weeks. HbA1c increased slightly by 0.3%. Healthy people ate honey for 12 weeks. Blood sugar did not change significantly. Conclusion: normal people can use honey in moderation, but diabetics need to be extremely careful. 3. The real benefits of honey. It is undeniable that, in addition to sugar, honey contains antioxidants, flavonoids, polyphenols, minerals, potassium, magnesium, zinc, mild antibacterial effect, thanks to natural hydrogen peroxide. Research in the Saudi Medical Journal, 2017, shows that honey can improve inflammation, reduce bad cholesterol in some patients. Meaning, honey is not completely bad. The problem lies in the dosage and the subject of use. 4. Risks. When diabetic patients use honey, rapid increase in blood sugar. Just 1 to 2 tablespoons of honey, fasting blood sugar can increase by 1 to 2 mmol/L. Effects on HbA1c, regular use. HbA1c increases by 0.5% after a few months. Risk of weight gain. Honey contains 65 calories tablespoon, easily causing overweight, a dangerous factor for type 2 diabetes. Effects on drugs. Honey causes blood sugar to fluctuate, making it difficult for doctors to adjust the dose of insulin or metformin. In particular, type 1 patients, insulin dependent, absolutely do not use honey regularly. Type 2 patients can only use very little, occasionally, and must check blood sugar immediately afterwards. 5. Reality. A cautionary tale. Mr. Tran Van L, 62 years old, in Hanoi, has had type 2 diabetes for 7 years. He followed the advice, drink turmeric honey every morning instead of supplements. After 3 months, fasting blood sugar increased from 8.1 to 10.4 mol/L. HbA1c increased from 7.2% to 8.5%. Result: the doctor had to double the dose of metformin. He also had high blood fat. The doctor concluded, the main fault lies in the honey, not the turmeric. What do you think? If your relative had diabetes, would you advise them to use honey? Leave your opinion in the comment section. 5. Reality. A cautionary tale. Mr. Tran Van L, 62 years old, in Hanoi, has had type 2 diabetes for 7 years. He followed the advice, drink turmeric honey every morning instead of supplements. After 3 months, fasting blood sugar increased from 8.1 to 10.4 mol/L. HbA1c increased from 7.2% to 8.5%. Result: the doctor had to double the dose of metformin. He also had high blood fat. The doctor concluded, the main fault lies in honey, not turmeric. Mild CTA. What do you think? If your relative had diabetes, would you advise them to use honey? Leave your opinion in the comment section. 6. Is there a better type of honey for diabetics? Many people tell each other, pure, wild honey. Manuka honey, New Zealand. Natural bee honey. But science confirms, no matter what kind of honey, the main ingredients are still glucose and fructose. Manuka honey has higher antibacterial activity, good for the throat and stomach. But for diabetics, there is still a risk of hyperglycemic blood sugar. Advice: if you want to use it, consider honey as a tonic. Use 1 small spoon 1 to 2 times a week, and always check your blood sugar after 2 hours. 7. Combine turmeric plus honey. Should or not? This is a very popular folk recipe. Turmeric honey. Turmeric is good for anti-inflammation, stomach, blood sugar. Honey has antioxidants, but is still sugar. If combined, normal people can be good. Support digestion. Diabetics. Little benefits, more harmful. Experts recommend, if you want to use turmeric, choose standardized curcumin tablets. If you want to use honey, use very little, and do not mix with turmeric to make your own medicine without the consent of your doctor. 8. Summary of honey. Beneficial, contains antioxidants, antibacterials, good for digestion. Harmful, still sugar, increases HbA1c, causes blood sugar fluctuations. Recommendation: diabetics should limit as much as possible or avoid completely if they have poor blood sugar control. If you find this analysis useful, please like the video to support the channel and share it with those who need it. Next part. So finally, what is the orthodox medical recommendation on using turmeric and honey for diabetics? In part 3, I will share the views from endocrinologists and nutritionists, which can help you know exactly which to or should not use, and if so, what dosage is safe. Part 3. Medical recommendations, facts and solutions. 1. Views from major medical organizations. To end the debate. Should or should not drink turmeric and honey when having diabetes? We need to rely on official guidelines from leading medical organizations. American Diabetes Association, ADA 2022. Do not recommend using honey as a sugar substitute. All natural sugars, honey, brown sugar, palm sugar, etc., increase blood sugar. Prioritize the DASH or Mediterranean diet with lots of green vegetables, fish, nuts. WHO, World Health Organization, recommend that the total amount of free sugars, including honey, does not exceed 5 to 10% of total daily energy. For people with diabetes, the less the better. Research on PubMed, 2020. Curcumin, turmeric extract, has been shown to reduce HbA1c by an average of 0.6% after 3 to 6 months in patients with type 2 diabetes. However, Honey causes a slight increase in HbA1c of 0.3–0.5% when used regularly. What this means: turmeric equals potential support. Honey equals should be limited as much as possible. 2. So should we use turmeric honey? Normal people without diabetes can drink turmeric honey 2 to 3 times a week to support the stomach, anti-inflammatory. People with diabetes should not use regularly. If you want to use, you should only use curcumin in standardized dosage tablets. Avoid mixing with honey because it will increase blood sugar. Practical example: at the Central Endocrinology Hospital, Hanoi, in the group of patients who tried turmeric honey, people with stable blood sugar, after 4 weeks, still maintain HbA1c a 6.8%. People with high blood sugar fluctuations, HbA1c increased from 7.5%, 8.2%. This shows that not everyone is suitable, and the risks are still greater than the benefits. 3. Safer alternatives. If you want to take advantage of the anti-inflammatory and blood vessel protecting effects of turmeric, choose curcumin nano tablets, 20–30 times more absorbed than turmeric powder. Combined with black pepper, piperine, increases curcumin absorption. Drink with almond milk or unsweetened turmeric milk. As for honey, instead of drinking it, you can use it topically. Disinfect small wounds. Dilute it to reduce sore throat, but do not drink it as a daily sweet. 4. What do endocrinologists recommend? Dr. Nguyen Thi H., Central Endocrinology Hospital, said, "Many diabetic patients mistakenly think that honey is healthy. In fact, a spoonful of honey is enough to cause blood sugar to spike. Turmeric can support, but does not replace medication. Patients must always aim to control HbA1c 7%. Dr. David Jenkins, University of Toronto, Canada. The important thing is not to drink turmeric or avoid honey, but the whole lifestyle. Eat lots of green vegetables. Exercise at least 150 minutes a week, control weight, and get enough sleep. 5. Philosophy of life. We cannot choose to drink a miracle drug to treat diabetes. Eating habits and lifestyle are the root. Turmeric can be a friend of the sick, but honey can be a sweet enemy. The famous saying of Hippocrates, the father of modern medicine, is always true. Let food be thy medicine, and medicine be thy food. Let food be your medicine. If you or a loved one is living with diabetes, check your diet immediately. Don't let folk tips fool you. Consult your doctor before trying any recipe. If you find this video useful, like the video to support the channel. Comment your opinion. Are you using turmeric or honey? What are the results? Subscribe to the channel to follow the series Expert Answers, where we scientifically analyze folk advice. 7. Introducing the next video in the series. In the next video, I will share, should diabetics eat sweet fruits? Surprising truths from new research. This will be one of the most popular and controversial questions. Don't miss it. Are you using turmeric or honey to support diabetes? Share your experience in the comments section. Don't forget to like and subscribe to the channel to watch the next videos in the Expert Answers series.